is Ann-Marie Léporé, and I'm an occupational therapist. And welcome to the second Taking Care segment on modifications. Here, I will walk you through various safety tips and tricks to think about in the kitchen. When looking at the kitchen, it is important to use common sense and consider the roles in the home. If the person with ALS does the cooking, then the safe access to the stove, oven, and to the prep area needs to be considered. If cooking is done by someone else, then access is usually restricted to the kitchen table, the refrigerator, the sink, and to the microwave or the toaster oven or the countertop hot plate. Like for any other room, look at the width of the door, the presence of a threshold, and the type of floor covering. A whole kitchen renovation is most often not needed when thinking about ways to assist the person with ALS. Here are some possible modifications and energy conservation techniques. Remove the small carpet on the floor by the sink and remove the clutter to decrease the risk of falls. Reposition the kitchen table to allow more room to access your chair and use a chair with armrest. You can also change your sitting place for easier and safer access. Consider replacing the cabinet knobs with pull handles and faucet levers instead of dials. You can optimize task lighting. Now you can use assisted devices such as jar can opener, a cart, adapted cutting board, a rocker knife, build-up utensils or foam tubing, an anti-slippery mat, a universal cuff, a scoop dish, or an adapted cup. Organize the items you use the most and that are the heaviest in such a way that they are closest to you and easy to reach. On the counter, lower level shelves. When doing an activity in the kitchen, plan ahead, take breaks, and perform tasks in a sitting position. Here's an example of some teaching I did at home with the family. So Mr. Smith, I brought some technical aids for you to try because I know you have some weakness and some fatigue. So come, we'll give it a shot. There you go. There you go. Have a seat on the higher chair. It's going to help your weakness in your legs. Getting up, it'll be easier. And you'll be able to help prep the food here in the kitchen. Perfect. You okay? Okay. So this is a tubing that we can find. It's easy. You just make the handle of any of the utensils, small items, bigger. But there are also some on the market already made, different style, different models, depending on your needs. And there's also this adapted cup, okay, one of the models where you can hold it with two hands and it helps you to drink without dropping the cup. When using a wheelchair, make sure there is enough space to allow moving around and turning. If you're doing a complete U-turn, a 360-degree turn, you will need 5 feet in diameter. For a T-turn, which is 180 degrees, like leaving the table, you will need 3 feet of clear space in each direction. Also, make sure that there's sufficient clearance under the kitchen table. Most costly modifications could include removing cupboards under the sink to allow wheelchair access, lowering and rounding countertops, or replacing appliances for smart ones. There are many universally designed products that are aesthetically pleasing, which means that your home doesn't have to look institutional. Here are a few website links if you're interested in learning more about assistive devices. Thank you very much for joining me in this Taking Care segment. Stay tuned for the next Taking Care segment.